Good afternoon. My name is Michelle S. Fernandez. I'm a student of South University. I'm doing my head-to-toe assessment for my family nurse practitioner program. My name is Michelle Fernandez. I'm a student of South University. Today I will do my head-to-toe physical assessment for my patient right now, which agreed to do and participate with me. Her name is Raquel. So before starting, I already washed my hand. I will just put in hand sanitizer just to do some sanitation. When she came in, she already weighed herself. She's 125 pounds. And then she did already the Snellen chart to check her vision. And she is on the 20/20, and it's normal and no problem. She doesn't wear any glasses, no reading glasses at all. And then her blood pressure right now is 125/80, heart rate is 75, respiration is 18, and temperature is 97.5. Before coming in, before she sit in the chair, she already emptied her bladder. And are you comfortable right now?
Yes.
And can you tell me your complete name?
My name is Raquel Tamban,
And then do you know what's the date today?
October 24, 2019.
Okay, so her neurological status is intact. So do you feel any dizziness right now?
No, I'm fine.
Do you have any headache?
No, I'm good.
Okay, so everything are good. So before we will start her physical, so we will start on her head. So I will palpate her head. So no lesion, no any deformity in the head. Her hair is evenly distributed. And then now I will be checking her face. First physical assessment that I'll be doing is I'll be checking her head and then her face. So I'll be inspecting her head. Her head is normocephalic. Her hair is evenly distributed. No lesions, no bumps, no atraumatic noted. And then I'll be checking her skin is smooth and pink. And I want you to close your eyes real tight and then make a big pout. Pout your lips and then wrinkle your forehead and then give me a big smile. Okay, her cranial 7 is intact, no drooping, no facial drooping, no weakness, and then it's her face is symmetrical. I don't see any deformity, nothing like abnormal, everything are well intact. I'll be checking her TMJ joint. I'll palpate her TMJ. Okay, can you open your mouth? Okay, move it side by side. All right, her TMJ joint is well and intact. There's no clicking sounds and no abnormality noted. And then now I'll be checking her sensory. And let me know, tell me if it's sharp or dull.
Okay.
Okay? I want you to close your eyes. And I'll be putting something, I will slide something in your face. Is it sharp or dull?
Dull.
Sharp
Dull.
or dull?
Dull.
Sharp or dull?
It's dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Other one? Sharp or dull?
Sharp.
All right. Her sensory is well and intact. She were able to detect what's the sharp and dull correctly. And then next, I'll be checking her eyes. I'll be using a pen light. So this pen light, I will just slide this in your, shine this in your eyes. Don't move your eye, okay? I'll just put this in your eye. So her eyes is, her pupil is round, equal, reactive to light and accommodation. And I'll be checking your sclera. Can you open, can you move your eye up? Other one. Her sclera is pink No, the conjunctival area is clear, no exudates noted. I don't see any redness. As I said before, when we used the Snellen chart, her vision test was 20/20, and there's no optic nerve damage. Optic nerve is intact, and um, no irritations noted on her eyes. Next, I'll be checking her extraocular muscles. So I want you to follow my finger without moving your head. Okay?
Mm-hmm.
Okay, her extraocular muscle is well and intact. I want you to follow my finger also up and down. And then next, her peripheral vision. So I'll be going to her back. Tell me if it's left or right.
Left. Right. Left. Right.
Alright, her peripheral vision is intact also. No nystagmus noted. Her cranials 3, 4, and 6 are intact. No deformity noted, no abnormality noted. Next, I'll be checking her ears. So I'll be using an otoscope. First, I'll be checking her auricle. Is there any pain or tenderness that you're feeling right now?
No.
Okay, so I'll be using this. I'll just shine on your ear. Next, I'll be the other ears. Her ear canals are clear. A little bit of cerumen. It's patent though. No redness, no drainage, no exudates noted, no foreign objects observed, and her tympanic membrane is pearly and gray, and the bony landmarks of her ears is in place. So no abnormality noted in her ears. So now I'll be checking her nose. I'll be using a pen light also to shine her nose. I just want to check her patency. So can you lean forward, please? Her nasal passages are clear. Her nasal mucosa is pink. There's no drainage, no exudates. Her turbinates are pink. There's no swelling noted. Are you in any pain right now?
No, I'm
You're
okay.
good?
Uh-huh.
Are you breathing okay? No difficulty?
No.
Okay, her nose, her nasal passages are very symmetrical, no subtle deviation, and everything are good and well intact. Now, I'll be checking her mouth. So at the same time, I'll be using also pen light. So can you open your mouth, please? Say ah. All right. Her oral mucosa is pink and moist. Ovulus midline, the pharynx is in non-erythematosus and without exudates. The soft palate is symmetrical. Her teeth are in good repair, no cavities, no missing teeth. And do you have any difficulty swallowing?
No.
All right. So her mouth is well intact and no abnormalities. Now I'll be checking her neck. So her neck is very symmetrical. I want you to make your neck move side to side, please. Okay, front and back. And then I'll be palpating her thyroid. Okay, can you tilt back? Can you swallow, please? All right, her lymph nodes, there's no nodules noted, no swelling. Are you in any pain right now?
No.
Do you have any difficulty swallowing?
No.
No? Okay, so no thyroid megaly nor cervical lymphadenopathy, no nodules. Her neck is very symmetrical, no, everything are well intact, and everything are in good shape. Now I'll be checking her lungs. I'll be using my stethoscope. In normal setting in hospital, the patient normally wears gown, but here I'll just put my diaphragm of my stent direct to this patient's skin. So the chest wall is very symmetrical, and I will check the 4 quadrants of her lungs. So I want you to do in and out, deep breath, please. One more. It's clear. Another one. Perfect. And I'll do the same thing. Do a deep breath for me also, in and out. Check in your back. Last one. Good. So the lungs are clear in all four bases of the of the lungs, and then no wheezes, crackles, bronchi, no deform abnormality noted. And did you have any cough recently?
No.
All right. So um, the span is very stable. It's midline, and no back issues, right? You have no pain. Yeah. So all the lungs, it's very intact, and it's well no problems with the breathing, regular and even and unlabored. All right, our next one, we will be checking her heart. So I'll be using also my stethoscope. Do you have any recently chest pain?
No.
No palpitations?
No.
No irregular heartbeat?
No.
Okay, so I will be using this one. Okay, just breathe normal. Heart sounds are good. It's normal. I'll be doing the same thing in your back. Would you mind to lean forward, please? I'll be checking your four sides also. Perfect. The other one. And then the last one. Alright, so the S1, S2 is normal and present. It's regular in heart rate, and then the rhythm is normal also. The S3, S4, no clicks, no murmurs, no irregular rhythm or irregular sounds, no rubs, no murmurs present. So everything are well and intact. The capillary refill, oh, before she's using right now she has her acrylic color in her nails. But before that, when she has none like that, her capillary refill was normal. It's less than 2 seconds, and then the pulses are like +3 and no edema present on her body. So everything in her heart are good and well intact. Checking the strength of her musculoskeletal, since we already checked the range of motion, everything are well and intact. So the shoulder, can you lift your shoulder up? I'll be putting a strength on my hands on your shoulder. If you can lift your shoulder, push against it. Perfect. The cranial nerve 11 is very intact. There is no deformity. And then I'll be checking your elbow. So if you can do, extend your arm please, and then bend it. Okay, and then I'll put the pressure. If you can push my hand, push against me. Good. And then I'll be checking also your wrist. Can you do up and down? Do like this. Okay, how about your hand? Okay, then close. And then I'll be putting also same pressure. If you can open your arms wide.
Hands.
Your hands wide, and then your open it. And then I'll be putting a pressure. Can you make it close? Close it. And then I'll be putting a pressure here. Can you close, open? Yeah, good. So everything are well and intact. There's no mass, no deformity, no weakness noted. And and everything, when she was able to stand up, we will be checking her gait. So I'll let you walk from here to there. We can see if there's no like imbalances. If you can stand up, please. And if you can walk on the side, please. All right, and then come back. Come back. So the gait is very steady, no weakness, no shuffling gait. So everything are good. And now we're ready for the next phase, which is the lying down position. The next one, we will be checking the gastrointestinal of my patient. So you had a recent bowel movement today,
Yes.
and did you able to pass gas too?
Uh-huh.
Yes, okay. So I'll be checking also her bowel sounds in all four quadrants using my bowel just to check the brewery also. All right. Perfect. So normal, everything are present in all four quadrants. And at the same time, I'll be checking the vascular sound and the renal artery sounds. Vascular sounds and renal artery sounds are present. They're all normal. And then now I'll be percussing her abdomen. Normally we use 2 fingers to percuss the abdomen. Sometimes we use 2 fingers for each quadrants of the abdomen. So I'll be percussing it. So percussion, the sounds are good and normal. It's all within normal limits. And I'll be checking also the spleen and then the liver if they're all in good shape and if there's like any abnormality. The spleen is located in the left quadrant of the abdomen. And then also I'll be checking the liver. Using palpation too. So no hepatomegaly, no splenomegaly, so there's no enlargement. The liver and the spleen are within normal limits. Everything are good and it's in all shape and well intact. We will be checking her range of motion in lying down position. So I want you to lift your hands up in the air, please. And then side. And then down. All right. And then now, do you have any pain right now?
No.
Do you have any tenderness?
No.
No. Okay, perfect. So I'll be putting a pressure on your shoulder too. No pain?
No.
No tenderness?
No.
All right. And then I will put pressure on your legs. And then can you lift your leg? Push it against the other one. And then how about your hips? Lift your hip, please. Perfect. Everything are intact. And then I'll be doing also her toes. So I want you to, your foot, if you can push it up and then outward, and then the same thing. And then the other one. So I'll put pressure also here. If you can push it inward. And then the other one. All right. So the muscles and the range of motion are well intact too. There's no deformity. There's no weakness noted. And everything are well intact. And then now we will be checking the flexion and the extension of the legs. So I want you to put your other leg on the other side, please. The other one. Perfect. The next one. Good. So reflex are good. And then The flexion extension are in well intact too. So now we're done with the lying position. So in few minutes we will be putting her, I will let her sit down, and then I will check her flexion, the reflex of her toes, and then her knees. So now I'll be checking the patellar reflex of her knees. So can you I'll be doing this. I don't have any the tuning fork, but I'll just use the replacement of it. No, just put like that. Other one. All right. So the patellar reflex are normal. It's well intact. So her sensory is good. So everything are in coordination. So this is the end of my head to toe assessment. Thank you for bearing with me, and thank you with the participation of my patient. And now I'm Michelle Fernandez, a South University student for Nurse Practitioner Program. Thank you.